Hi, I'm Dr. Andre Kumar. This is the Stanford 25 ultrasound series. In this video, we'll be discussing renal ultrasound and bladder ultrasound. Thinking about the indications and benefits of renal ultrasound, there are several things you can identify pretty readily at the bedside. These include hydronephrosis, nephrolithiasis, cysts, and the general size of the kidney. Things that are beyond the scope of point-of-care ultrasound, including the evaluation of ureteral stones, vascular malformations, flow of the kidney, and determining if there are renal masses or malignant potential of cysts. Let's discuss acquisition of the kidney. There are two probes you can use. You can either use a phased array probe or cardiac probe, or a curvilinear or abdominal probe. A phased array probe has a smaller footprint, which allows for easier visualization between rib spaces, while a curvilinear probe has a much wider view and greater depth and penetration. For this particular video, we'll be using a phased array probe. You'll want to set your machine to abdominal mode, which allows for optimal image depth, gain, and frame rate. By convention, the dot on the screen is on the left side of the screen. Going to get my gel. If you have a patient, have them lie completely flat in bed. If it's a hospital bed, try to lower the head of the bed so they're completely flat. You want them to also have their hand pointed directly behind their head. This opens up the rib spaces and allows for much easier visualization of the kidney. My orientation marker is pointed towards the patient's head. A couple of other landmarks that are relevant include the anterior axillary line, mid-axillary line, and posterior axillary line. For renal ultrasound, I'm generally going in the mid to mid-posterior axillary line just because the kidneys are retroperitoneal organs. I'm placing my probe about in the 8th or 10th intercostal space with my marker pointed up towards the axilla, and my probe is going to be perpendicular to the patient. A little cold gel. I can also use my index finger to anchor myself on the patient. Here we can see the renal anatomy. On the top of the image, we see the liver. Between the liver and kidney is Morrison's pouch. The kidney here, we can see the cortex, the medulla, and the medullary pyramids. In some patients, you may also see cysts, which are generally more towards the periphery. You can also obtain a cross-sectional view of the kidney by rotating the probe 90 degrees and scanning from a superior to inferior fashion. You can use this to measure the length and width of the kidney. Let's go ahead and scan the left kidney. Keep in mind that the right kidney is lower in the abdominal cavity than the left kidney, so you may have to go up one or two rib spaces when scanning. Again, my marker is pointed towards the patient's axilla. The patient's left arm is behind their head. And I'm going to generally be in the mid to mid-posterior axillary line. When I'm scanning, one of the things I want to do is point my probe a little bit more posteriorly towards the back of the patient, again because the kidneys are retroperitoneal organs. Here we can see the left kidney, we can see the cortex, the medulla, and the medullary pyramids as well. And if I wanted to take size assessments, I can rotate the probe to get the entire picture. Now let's discuss bladder. So when thinking about bladder ultrasound, this can be quite helpful in patients on the hospital ward who are elderly, confused, and you need to assess if they have urinary retention as a potential cause for their altered mental status. When thinking about bladder ultrasound, there are several measurements that you can take at the bedside to assess if they have substantial volume within their bladder. First, let's just discuss scanning of the bladder. You're going to be quite low in the abdominal cavity, well below the navel. When I think about my orientation marker, my marker to start is pointed in a 3 o'clock position. In most patients who have some fluid in their bladder, it's generally quite easy to visualize. My probe itself, the head is pointed more towards the pelvis as I'm scanning. Here we can see the patient's bladder. If I wanted to do measurements of the bladder, there are several ways I can do it. I can measure the width as well as the length in this particular view. I can then rotate my probe about 90 degrees, so it's pointed towards the head. And from here, I can measure from the top of the bladder to the bottom, and that is its height. When we're thinking about the formula to actually measure bladder volume, it is 0.53 times the width times the length times the height. Let's discuss pathology. First of which is the size of the kidney. A normal kidney is about 9 to 13 centimeters in length and about 4 to 6 centimeters in width. They should be similar in size up to a 2 centimeter difference. You may have seen in ultrasound reports a finding called medical renal disease. What that essentially means is you see a small atrophic and hyperechoic kidney, as we're showing on this image here. Another common pathology that you can look for is hydronephrosis. With hydronephrosis, the center of the kidney, the medulla, is replaced by black fluid. There can be various degrees of hydronephrosis, ranging from very mild to more severe, as we're showing here. Keep in mind, in patients with very severe hydronephrosis, the kidney almost appears like a giant cyst, and it may actually be difficult to discern this. Practice is always what's needed to be able to distinguish from a more mild to moderate to severe disease, although we don't quantify that in point-of-care ultrasound. Finally, when we're thinking about stones, when we think about nephrolithiasis, these stones are often found in the renal pelvis. Ureteral stones are much less sensitively detected by point-of-care ultrasound. A stone shows up as this bright hyperechoic line in the middle of the kidney, as we're showing here, and it casts a shadow. The reason why it casts a shadow is the ultrasound waves are not able to readily penetrate through the stone, and as a result, you see a shadow being cast behind it. This shadow may actually be one of the few things you're able to visualize rather than the stone itself, so be sure to look for it.